teaching kingdom values through healthcare. So, as you know, I've gone to some really interesting places last year. Oh, thank you so much for the food there. I've been inspired by people like John Whitehall, who has a passion for crazy, dangerous places to bring God's values. And I don't go to quite as crazy or quite as dangerous some of the places that John go to, but I love that he does that. And I am currently working on the Macedonian principle that if people ask me, I've got. And so many of these places I go to are places where Christians are not allowed. And because I bring with me my medical education background, I'm one of the associate professors at the University of Sydney. I'm in charge of the online medical, Masters of Medicine, Child and Adolescent Health course. So it just gives me license to travel in the name of the university, unpaid of course, but with that, it opens doors. And so how can I teach kingdom values through health education? So this is something I'm going to share with you. Is this going to work? Next. Chris, why is it not advancing? Oh, yeah, maybe I just have to put this down. Okay, so as health professionals, as Andy says, we've been really blessed with a good education, particularly here in Australia, and a profession that can bring health and healing and alleviate suffering, which is what Jesus did. Health education offers a unique opportunity to empower others to teach by teaching and sharing our medical skills and knowledge, and this can be used even in situations that are hostile to Christianity. And by teaching using kingdom values, we can show what is unique about Christianity. And I think Andy sort of talked about crime is actually about the value. It's not about the method. It's not about the content. It's actually about the value we instill as we teach. And so this is a little interactive thing. In cross-cultural settings, though, we encountered different values when teaching, and I was quite challenged by this. And I'm sure many of you who've done cross-cultural teaching would have been challenged by these. These values impact on our behaviour as we teach them and on their response to us. And my question always is this just cultural or is it anti-Christian? Like, is this just cultural and it's okay and really I'm just bringing my Judeo-Christian Western mindset to them? Or is that actually something that, you know, God needs to speak truth into? And therefore, do they need to change? So when we teach, we often challenge these values, and like the thing that I bring back to, so one of the big challenges I found in teaching in China is that they have really no concerns with publication of research data that's not authentic. And when I speak to them about it, it is an accepted normality in their culture. They acknowledge it. They don't think it's terribly bad because if you've got a publication in a peer-reviewed journal, that far trumps the fact that you falsified your information. So to me, that's encroaching kingdom value stuff. You know, truth is so important. So I then look at these sort of questions. I ask myself, what is my purpose for teaching? What will I teach? Why are we teaching? And then how do we teach? And I sort of bring all of that in what we do. And so I was starting to think about sort of worldly view versus kingdom values. And this is open for you to fill in the right-hand side. And I thought just sort of call out. So I was thinking worldly values. For those who went to the CMDFA dinner 2 years ago, I can't remember his name, did a really excellent talk about worldly values versus kingdom values. But, you know, worldly values, relationships are transactional. People's worth are measured by their productivity. You know, if you can come and bring something that's going to be good for me, then that's okay. But what's in it for me? That what's in it for me mindset is so worldly. Autonomy and self-sufficiency. We like to do things on our own, do it all by ourselves. We're often too proud to ask for help, and you get one up and you suffer. It's driven by societal norms. Often it's tribal, you know, like what's in it for my group as opposed to what's actually best for everyone. and often they see healthcare as a career rather than a calling. So what are your thoughts? This is an open mic. What are your thoughts about kingdom values that maybe might challenge those worldly values, or kingdom values that I think you could put into? Is that too hard a question?
I'll kick off then. I think from a relationship point of view, we are loved unconditionally.
Okay. Thank you. Yeah, unconditional love, and sort of going with that is that intrinsic worth of the human, that we are created in God's image, loved by God, irrespective of our illness or.
People's worth measured and protected right from childhood. Value those who are on the top of the class. And I think as teachers, we can bring that, and it's not always easy to differentiate. Look, this person may not be a good student. There is a value and worth because he's created in the image of God.
And often students, it's interesting, I was actually talking to some students of mine yesterday and asked them, what are the I was talking to people who were wanting to be pediatricians, and I said, what influenced you into the choice that you made? And they said, oh, I had a teacher who really inspired me because they treated me well. It was all relational, and they felt worth rather than, something like pediatrics because patients. So yeah, that caring some.
Something like people have value, just for being people, and not for what they can produce or what they contribute.
Yes,
but that they.
And as you get to know them, you may find they have all sorts of specific values for the community that you didn't see on your first class, like your student. Not only do they have value, that value shows in various ways that you may not have seen because your measure is wrong, which fits with driven by societal too. And I was actually going to talk about driven by societal norms, that we want to be driven by seeing things as Jesus would have us see them. And probably can't do that on our own. If we possibly can, we need to talk to others who have that sort of, to help us kind of fix our norms differently.
Yeah. It was interesting your comment about seeing others differently. I was reading somewhere that they tried this method of in an old people's home having a photo of the old person as a young person up, and it changed the way the nurses treated them. But then someone complained was they forgot to take down a picture of someone who was young, female, and her husband was there. And the visiting wife was saying, why is there a young girl's picture on my husband? But apparently that then got pulled down. But I thought, I just thought the concept of having, we forget people who are older have had a youth, and could be totally different from the stereotype we usually do that. That usually,
I didn't expect to get this personal this early.
Sorry.
But at the moment, my medical future is under review by the Medical Council because of what I believe is a contest between kingdom values and worldly values with regard to the transgender children. I believe that the kingdom value is that we are to be looking after them, doing what it says, beneficence, non-maleficence. There should be no side effects of it. There should be justice and so forth. Under the worldly values, it's how the child is brought to you, expressing his or her desire. Under the ideology that transforming is like a good thing for human beings, and with denial of the ethics of sharing truth, because no one's talking about the major side effects associated with blockers, cross-sex hormones, or certainly with surgical intervention. So we have a big some of us anyway have a big problem with that right now. Yeah.
Thanks for sharing that. And we will be praying for you because, I mean, John's putting his career on the line to set up for human truth. So sometimes it really hits the ground. So, yeah, thanks for that.
Sorry. Healthcare as a career versus healthcare as a calling. I think we don't see purely from a career perspective, but we see there's something God has entrusted us and bring value and life to people we come in contact with.
Yeah, and John's exemplifying that, isn't he?
I was going to say the autonomy, self-sufficiency is probably more of a Western world value. The list might be different in different
That's
places,
true.
which you were talking about bi-directional learning.
That's right.
You know, that's and possibly the challenge in some places as a worldly value is you absolutely must conform with the community, which also makes it hard. Whereas the balance of the kingdom value is maybe somewhere in between of respecting the individual and realizing their only function as members of a community. Yeah, which is like the church. So there is a bit of that. Yeah.
So I didn't understand that actually. What is autonomy and self-sufficiency here?
So autonomy and self-sufficiency is very much like where John's saying the gender stuff is coming from. Like, we are individuals. I have a right to be female today or male tomorrow if I so choose, and you have to give it to me. That's autonomy. And some other cultures will be like, the society says you must do this. Society says we don't have any transgender here, so therefore you must hide it. So, I mean, I think probably both are equally wrong, but then we need to say, well, what is Jesus speaking into that? What's the kingdom values that it's challenging, and what's the balance? And it's often not that easy. And do no harm and doing good is such a kingdom value, as John says, that when you look at the debate about gender, which has lots of values being challenged, to not harm a child is 100% kingdom value. There's no debate on that one, you know. Whereas the autonomy and all of that can be a bit.
But a sort of cultural example, one is, for example, if an adult has a chronic mental health condition and somebody is very involved as their carer, their spouse, their parent, their child. In a lot of mental health institutions, outpatients in Australia, the carer brings them along. They have a 3/4 of an hour consultation, the patient and the doctor or whoever's looking after them, nurse practitioner or whatever, and then they go away and nobody actually involves the carer at all. Like, it's hard for the carer to get information because of the patient's autonomy. And that's actually probably not good medical practice, because the carer is the person looking after the 365 days a year, not 45 minutes. You know, it actually doesn't help the patient. It's autonomy gone so strongly. Whereas in some cultures, the opposite. Someone has cancer, the family says, oh, don't tell them, so they don't tell them, even if they ask. Even if they ask, have I got cancer? Oh, no, because of that, you know, like, so that's the opposite of autonomy. So you actually see it in less charged situations as well, the concept of autonomy and self-sufficiency. The one John was sharing with us has got all sorts of political overlay put onto the concept. Yeah.
You can see we can think on and talk forever. I mean, I'm now just moving us on in the interest of time. So, kingdom values is one of the prime courses that Dave Crick is going to talk a little bit about tonight. So some of these slides are stolen from him. So there are 6 kingdom values he often talks about, and they're there. So just very briefly, seeking first the kingdom of God. That again, you know, stuff we've talked about. We're made in God's image. We do what we do for God's glory. Judge and you'll be judged, which is about somebody was saying, you know, like, you know, people who are productive or judging people by their age or whatever. It's helpful to think, what if we had made that, this is particularly, the top one was particularly in regard to medical errors. So when, you know, your junior or somebody around you, you're the nurse that worked with you or the other doctor or whatever makes an error and you get angry, how are we to respond? Or if a student gives you a wrong answer, how are we to respond? To reflect back and think, what if we had made the healthcare error, and the kingdom value of separating the person from the mistake, you know, love the sinner, hate the sin type concept, and the role of grace and restoration when there's brokenness for whether right reasons or wrong reasons. So that's the kingdom values 2. Oh, did I jump 3? Rubbish in, rubbish out. It's like, where do you spend your time? Where do you focus? It's good to bring in prayer, God's word, God's presence, God's people, others around you, godly influence and role models, and leave out, be very careful what comes out of you, our words, our behaviour, because it impacts on those around us and the message that we're trying to teach. So if what you're teaching and your behaviour don't match, it actually negates the message you're trying to teach. Use it or lose it. So important to make the most of our opportunities, really, and try and strategically train and develop your God-given goals. Sometimes it's scary to do stuff. Sometimes when I follow in John's footsteps, it's scary to do stuff. So it's a matter of exercising your faith, God's using godly opportunities and being sensible and just praying for wisdom and just not jumping in, seeking God's agenda, not your own. Sowing and growing. So I think one of the things we can do is to sow into the next generation. Our teaching actions and behaviour should reflect kingdom values and bring others to Christ. It should draw people naturally to find out why we're doing what we're doing and find out who we are. And the last one is humbling and exalting, and I think that's something I see really personified in applying. So often in health education, you know, people are one-upping themselves, saying how great they are. They're sort of, you know, trying to demonstrate their excellence. And often I don't need help, I can do this on my own. And I think that humility that comes from Jesus and just being willing to, what did you say, Rosemary? Not both way. The both way learning, to remember whoever we're teaching and whoever we minister to, the patient's perspective, that we're actually learning from each other, and just come from a place of humility and openness and just being willing to you know, step in. So, so how can we display kingdom values in places where our witness must be indirect? So that's looking at those many opportunities to some of these countries. We probably don't have time for this, but we can just have a quick discussion. As Christians, we should impart kingdom values. Therefore, how can we teach these kingdom values? How can we convey that they're different from the world's value? And what should we do when values clash? So that was going to be a discussion time. I think we're probably short of time for that.
If you're going to 11, go to 4.
All right, so we can do that a little bit. But my example of, I'll just tell. All right, let's have 5 minutes with the person next to you again. Have a little think about that, and rather than everyone feedback, I have got sticker notes which I'll pass to you. You can write your summary and we can stick it up in the week. Like, how about that? So how about 5 minutes to talk to each other through those questions, and I'll put the sticker notes. Just your attention back. So unless if someone has something really burning that they thought was fabulous, got to share it aloud with the group, you can do that now. Otherwise, if you've got some ideas, just put it on the board. People can have a copy and grab around and read it. I was just going to say, for me, the kingdom value that I was trying to instill with that situation about the Chinese and stuff was that I found that when I went into China, they really wanted to publish. They really want to learn research. And so I'm designing a course that's mainly run online, which I'm actually going to do to more than China. But the concept is I'm designing a 15-week online course on the basics of research which incorporates searching and critical appraisal, which brings into their mindset the understanding of research integrity and therefore truth, and the importance of that if you want to publish, and bringing God's concept of the importance of truth in, and also that concept of critical thinking rather than being just told what to do and following it. And so that's bringing that kingdom value of, you know, really seeking and thinking for yourself rather than just being dumped information you've got to incorporate. So I think they're really important kingdom values, and I see when I offer teaching research, I have open doors everywhere. And by going and building those relationships and teaching those, I feel I'm bringing what's in my space and kingdom value to those places, because then it generates people talking. So I didn't have anyone to share this, I just share your. So does anyone have anything burning they want to say on that topic, or otherwise you can just stick it on?
Ask a question. I'm just trying to kind of wrestle in my mind. So yes, I completely agree with you, that is kingdom values, but like from a non-Christian's point of view, like particularly in Australia, they might think it's just an ethical value that you bring.
Yeah, they may well be, because a lot of kingdom values are ethical, because our ethics is actually Judeo-Christian ethics. So ethically in China, you know, a good paper trumps telling the truth. So it's actually about the values that, I mean, they think it's good to tell the truth, but it's better to get a paper published, right? So, you know, so by teaching research integrity, that's my first lesson, and the importance of research integrity, it actually helps them appreciate that we value truth a little bit higher than them. Yeah, they value it a bit, but we think that truth is there. So, for example, the one sentence I said that in Australia, if I published something and someone found there was wrong data in there, I would lose my job. You know, if I falsified my information, I would lose my job. I said, we would get a promotion if we got data. And it was interesting because I was teaching them how to search using the PICO method, which we can talk about another time. And I said, let's you know, be cultural. Let's start with a Chinese database, and we'll come up with a clinical scenario, and you can search. And because I taught them using PubMed, because that's universal, it's in English, I can teach using that. And I said, you can choose either PubMed or your Chinese database. And they said, we're going to use PubMed. And I said, why? They said, we know, like this was even before I said the other stuff. They said, because we know that Chinese databases, the information isn't to be trusted. So I actually used that as my starting point, just saying, well, actually in Australia, you know, in PubMed, anything that you've read, if it's actually falsified, if it was found out, someone would lose their job. And they just found that amazing. Could not believe that. That was a cultural challenge to them. So I'm really comfortable in the research space. So I take something that I'm okay at, and I bring it there, and I think it just, there's so much kingdom value. And I think really anything you teach, if you're a person of, you know, of God, your kingdom values ooze out of you, whatever you teach, really. You're going to say something?
I was just going to say, so to answer maybe a different slant on that. So the tradition, my understanding, Christian, Judeo-Hebraic, one of flourishing or virtue ethics. So good teaching on ethics is crucial for us to understand drift, way of that, and the assault in a much more utilitarian, devalue virtue ethics. And it's a very interesting space that I know very little about. So I think you're right. It is a really important differentiation about ethical codes. But later in one of my presentations, what we think motivates us, and values that are hidden deep That's key. So ethics is really important. It's just a different lever to have a conversation.
And in fact, an ethical course would be a course that are welcomed by a lot of these countries. If you put it as Christian ethics, they'd probably ban you. But if you're putting the ethics in the context of something utilitarian, like that you need the ethics to do the research, they'll listen to it. And a lot of it is God's values, but how do you, in a closed country, bring that out without highlighting it's God's values? It's one of my son. Okay. My son came to the Lord recently, in the last few years, and how I prayed him into the kingdom is actually praying that he would love the values of God, and he does. And when you love the values of God, you start loving truth and care and whatever, you start looking at the person where that value comes from, which is God, right? So I think when we exhibit the values of God in all we do and aren't ashamed when challenged to ask it, answer our reasons for what we do, I think it opens opportunities. Particularly in closed countries where, you get kicked out. But, in countries where I have had many opportunities to share because it was people inviting me to share my story. It's not my upfront teaching stuff. So that's my door to go into the country. It's not just to proselytise, it's not to proselytise, it's to bless, but it comes with the territory. It's who I am. Anyway, so just to end on that, my hope is that these values will draw people to God. Matthew 5:16. And what we teach and how we teach it should be different from the world, so they go.